Hey everyone, so the reason you're watching this video is because you plan on having an excision of your Chalazion. And while this procedure is very simple, there's still some risks that you should know about. The first risk is risk for recurrence. And this happens in about 5% of patients. If it does happen, we will plan to excise your Chalazion again in about 2 to 3 months. Sometimes in that time period, that Chalazion will just spontaneously resolve, which is great. The second risk that you should know about is a risk of post-inflammatory hyper and hypopigmentation. And this is when the skin overlying the Chalazion changes color, either a little darker or a little bit lighter. And your body usually handles this very well, naturally, but it can take a few weeks to even months for the skin color to change back to normal. We might give you some creams or ointments, but typically the body handles this very well. The last risk is a risk of bleeding and infection. The risk of bleeding is very low. Typically, by the time you exit the exam room, you will have stopped bleeding. You might have some pink tinged tears that you'll blot out on your Kleenex, but that's about it. And the risk of infection, I've personally never seen one after a Chalazion. We give antibiotic ointment, which you will place 3 times a day on the eyelids, and this really prevents infection well. So if you have any other questions about risks of Chalazion excision, please let me know in person. Thanks.